Good morning, students. In the last class, we were discussing about the soft palate. So, we had seen from mouth to the soft palate. And today, we are moving to the next part, the pharynx. Pharynx is a funnel shaped fibromuscular tube which is situated behind the nose, mouth, and larynx. That means the extension of the pharynx is from the nasal cavity till the larynx. So it is a fibromuscular tube which is very close to the vertebral column. This is continues down as a esophagus. So this is the first tube that comes in front of the vertebral column. Apart from this, in front of pharynx and the esophagus comes a trachea. So these are the two tubes which is more connected or more related to the vertebral column. As this pharynx is having three parts, it is the nasopharynx, oropharynx, and laryngopharynx. Nasopharynx means the part of the pharynx which comes behind the nasal cavity, and the oropharynx that comes behind the oral cavity. Laryngopharynx is a part of the pharynx that comes behind the larynx. So, since these structures, the mouth, nasal cavity, and the larynx comes in front of the pharynx, it is called nasopharynx, oropharynx, and laryngopharynx. So, when we move to the first part, the nasopharynx, here you can see this is a nasal cavity. Behind the nasal cavity, we can see the part of the pharynx. So, this line represents the limit of the nasopharynx, the limitation of the nasopharynx. So, it starts from here till here. This is oral cavity, the mouth, oral cavity. Behind the oral cavity, you can see oropharynx. So, that starts from this line till this. That's a oropharynx. Now, this is a larynx that comes in front of the laryngopharynx. This is a larynx. This is another tube that comes in front of the vertebral column. So, the part of the pharynx that comes behind this is the laryngopharynx. Now, we can see the vertebral column here with pharynx in front and trachea behind. Pharynx, after the level of the larynx or after the level of the laryngopharynx, it continues down with the esophagus, which is another muscular tube. So these are the three different parts of the pharynx. So as we see the three different parts, the nasopharynx, oropharynx, and laryngopharynx. It is given in three different colors. The blue shaded area is the nasopharynx, and green color is the oropharynx, and pinkish is the laryngopharynx. We can see the structures which is present in front of each parts. Nasopharynx anteriorly opens into the nasal cavity, oropharynx into the oral cavity, and laryngopharynx anteriorly opens into the larynx. Now we will see the features of the nasopharynx. Nasopharynx lies behind the nasal cavity and above the soft palate. Here you can see this is a hard palate and this is a soft palate. So this is a nostril, nasal cavity, and part behind this is the nasopharynx. The wall of the nasopharynx is rigid and it is non-collapsible. It is completely or purely it is respiratory in function with no food ever enter. That means anyway it is anteriorly continuous with the nasal cavity. So the function of the nasal cavity is imitated by this nasopharynx. Even the epithelial lining of the nasal cavity is present inside the nasopharynx. Nasopharynx is also lined with the pseudostratified ciliated columnar epithelium, that was epithelium of the nasal cavity. Now it is limited below by the soft palate. This is a soft palate which lines the lower border of the nasopharynx. Then you can see the mouth, this is oral cavity, this is oropharynx. This is a larynx, this is a laryngopharynx. While taking the nasal cavity and the nasopharynx, infections are more common in this part. Hence, it is present many lymphatic aggregation. Like the nasopharynx is having collection of lymphatic follicles, and these lymphatic follicles are responsible for many types of infections. While seeing the roof of the nasopharynx, you can see the body of the sphenoid. Body of the sphenoid is a skull bone. It's the body of the sphenoid. Then basilar part of the occipital bone. This is hard palate. This is a body of the sphenoid which is with a cavity inside. That's a sphenoidal air sinus. And the continuation of this forms a sloped area, and this is the basilar part of the occipital bone. So this is the roof of the nasopharynx. Here comes the nasopharynx, and this is a roof. Roof is formed by the body of the sphenoid and basilar part of the occipital bone. Now, each part of the pharynx is having different features on its lateral wall. So while looking at the lateral wall of the nasopharynx, we can see a collection of lymphatic follicles, which is called nasopharyngeal tonsil or pharyngeal tonsil, which is present just beneath the mucous membrane at the roof. See, this is the roof of the nasopharynx. Here, a small collection of lymphatic follicles present, which is called pharyngeal tonsil. And this pharyngeal tonsil is more prominent in children, which get enlarged due to infections, and this kind of infection is called adenoids. Another feature is pharyngeal bursa, which is nothing but a mucous diverticulum which is extending into the nasopharyngeal tonsil. So the nasopharyngeal tonsil or the pharyngeal tonsil, which is present at the roof of the nasopharynx, is covered by a mucous membrane, and the same mucous membrane is having a diverticulum which is called pharyngeal bursa. And another feature is opening of the auditory tube. Opening of the auditory tube. Auditory tube is nothing but the eustachian tube which is connecting the middle ear with the nasopharynx. So this one end of the auditory tube opens into the middle ear and the other end opens into the nasopharynx. So you can see this opening here on its lateral wall. This is the opening, and above this opening there's an elevation, a thickened elevation, and this elevation is called tubal elevation. This is a tubal elevation. This is the opening, and this is a tubal elevation. And from the tubal elevation, two pharyngeal or two mucosal folds are running down, one towards the soft palate, other towards the pharynx. So this is towards the pharynx, and the front and the anterior one is towards the soft palate. So these two mucosal folds that forms salpingo-palatine fold and salpingo-pharyngeal folds respectively, because salpinx means tube. So here the tube is auditory tube, and the fold which is extending from the auditory tube till the soft palate is the salpingo-palatine fold, and from the tube, the fold which is extending into the pharyngeal wall is the salpingo-pharyngeal tube. Now we can see a collection of lymphatic follicles just above the tonsil, just above the tubal elevation, which is called tubal tonsil, that comes here just above the roof. So at this level, in the nasopharynx, we can see two group of lymphatic follicles, one at the roof, other just above the tubal elevation. Now, pharyngeal rhesus is a mucous diverticulum which is present behind the tubal elevation, which is nothing but a mucosal diverticulum which is present behind the tubal elevation. These are the features of the lateral wall of the nasopharynx. I will explain once more. The opening of the auditory tube, then just above the opening there is a tubal elevation. Then from the tubal elevation you can see two mucosal folds. One is running anteriorly, other is running posteriorly, and the anterior one which is extending from the tubal elevation till the soft palate. So it is called salpingo-palatine fold. And the posterior one which is extending from the tubal elevation till the pharyngeal wall. So it's called salpingo-pharyngeal fold. Then a collection of lymphatic follicle which is present above the tubal elevation, that's called tubal tonsil. Then another pharyngeal diverticulum or mucosal diverticulum is present behind the tubal elevation, which is called the pharyngeal rhesus. Next we can move to the oropharynx. Oropharynx is a part of the pharynx that lies behind the oral cavity. Posteriorly it is bounded by the second, third vertebra. Below it is continuous with the laryngopharynx. Now the communication between nasopharynx and oropharynx is called pharyngeal isthmus. So pharyngeal isthmus is the junction between oropharynx and nasopharynx. So this is a nasopharynx that ends here. This is a oropharynx. So this is a junction between nasopharynx and oropharynx. That's called pharyngeal isthmus. The feature which is present on the lateral wall of the oropharynx is nothing but the palatine tonsil that now we are considering as the main tonsil of the body. Palatine tonsil you can see on either side of the soft palate in the oropharynx in the lateral wall of the oropharynx. That's the one and only feature on the lateral wall of oropharynx. Now there is a collection of lymphatic follicle is visible in and around the oropharynx. While we are seeing from the nasopharynx till the oropharynx, we have different collection of lymphatic follicles. One is palatine tonsil on either side of the oropharynx, then tubal tonsil, pharyngeal tonsil. Both are present in the nasopharynx, tubal tonsil and pharyngeal tonsil. Then in the floor of the mouth is formed by the tongue, and the posterior part of the tongue is having another collection of tonsil which is called lingual tonsil. So all these collection of lymphatic follicles are connected by a ring-like structure, or by connecting these tonsils together, that forms a ring which is called Walder's ring. So Walder's ring is nothing but a group of tonsils, a group of lymphatic follicles which is present in and around the oropharynx. Next is the laryngopharynx, which is situated behind the larynx, that extend from epiglottis to the lower border of the cricoid cartilage. Actually, larynx, the extension of the larynx is from the upper border of the epiglottis till the lower border of cricoid cartilage. Since this laryngopharynx comes behind the larynx, we can say the level of the laryngopharynx is also extending between the epiglottis till the lower border of the cricoid cartilage. So the lateral wall of the laryngopharynx presents a fossa called piriform fossa. This piriform fossa is the one and only feature present on the lateral wall of the laryngopharynx. So while comparing these three areas, nasopharynx is having more features, and the laryngopharynx and the oropharynx are having only one feature on its lateral wall. The piriform fossa is having some clinical importance because the nerve which is supplying the larynx, called the internal laryngeal nerve, is lying just beneath the mucous membrane of the piriform fossa. So any damage to this nerve can cause sensory loss to the upper part of the larynx. While seeing the structure of the pharynx, it is composed of 5 layers from inner to outer. That is mucosa, submucosa, pharyngeal fascia, muscle, and the buccopharyngeal fascia. This is structure of the pharynx. So it consists of 5 layers from inner to outer. It is mucosa, submucosa, pharyngeal fascia, muscular coat, and the buccopharyngeal fascia. Now we can see the muscles of the pharynx. Muscles of the pharynx are intrinsic muscles and extrinsic muscles. Intrinsic means one end of the muscle is attached to the confined organ and the other end will be present somewhere else. That means outside the organ. Intrinsic means the muscle, the whole length of the muscle is present within the organ itself. These intrinsic muscles are the circular muscles. They are the superior constrictor, middle constrictor, and inferior constrictor muscles. Here you can see the superior constrictor, this is a middle constrictor, this is an inferior constrictor. These are circular muscles with gaps in between. But the extrinsic muscles are stylopharynges, palatopharynges, and salpingopharynges. Stylopharynges means it's originating from the styloid process present on the base of the skull, and the palatopharynges, one end is present in the palate, insertion is to the pharynx. So from the name itself, we can identify the origin and insertion of each muscle. Stylopharynges, origin from the styloid process to the pharyngeal wall. Palatopharynges, origin from the palate to the pharyngeal wall. Salpingopharynges, salpinx means tube. Here the tube is auditory tube. That is the tube which is related to the pharynx is the auditory tube. So it's originating from the auditory tube and inserted to the pharyngeal wall. So these are the muscles of the pharynx. Regarding its nerve supply, it is supplied by the cranial part of the accessory nerve, that's 11th cranial nerve. Then nasopharynx, sensory supplies by maxillary nerve, oropharynx by glossopharyngeal nerve, laryngopharynx by the internal laryngeal branch of vagus. Three areas are supplied by three different nerves. Nasopharynx is supplied by the nerve which is supplying the nasal cavity itself, that is the maxillary nerve. But the oropharynx is supplied by the nerve which is supplying the tongue, that's a glossopharyngeal nerve. Laryngopharynx is supplied by the nerve which is supplying the larynx, that is the internal laryngeal nerve, which is a branch of the vagus. Next is esophagus, the continuation of the pharynx, means that extends from the lower border of the cricoid cartilage till the stomach. And this esophagus is a long muscular tube about 25 centimeter in length. It extends from lower end of the pharynx till the stomach. It is an elongated tube and has three parts. The cervical part is passing through the neck, the thoracic part passing through the chest, and an abdominal part which is passing through the abdomen after piercing the diaphragm. So the three parts of the esophagus are the cervical, thoracic, and abdominal. Total length is 25 centimeters. It is related posterior to the trachea in the upper part of the thoracic aorta to the left, and posterior in the lower part. That means just in front of the vertebral column, you can identify the pharynx and its continuation, the esophagus. In front of the pharynx and esophagus, there lies the trachea. So the two tubes which is very close to the vertebral column are the trachea and esophagus. It passes through the esophageal orifice of the diaphragm and enters into the abdominal cavity. So after traversing through the cervical region and the thoracic region, finally it has to pierce the diaphragm. So diaphragm consists of three large openings, one for the esophagus, one for the aorta, and one for the inferior vena cava. These are the three structures that has to pass through the diaphragm from chest cavity to the abdominal cavity. So the esophagus is passing through the esophageal opening that pierces the diaphragm and enters into the abdominal cavity and joins with the stomach. This esophagus, I have already told that it's a collapsed muscular tube. Collapsed muscular tube in the sense it is not a rigid structure. It is collapsed and it becomes elongated, or it becomes straight only when food enters into this pipe. Unless otherwise, it will be a collapsed structure, and naturally it has several constrictions. The first constriction is present at the junction between pharynx and esophagus. That means at the very beginning of the esophagus, that lies at the level of the C6 vertebra. Second constriction lies where it is crossed by the arch of aorta. Third one lies where it is crossed by the left trachea, left bronchus, and the fourth one is present at the junction between the diaphragm and the pharynx. So these are the four natural constrictions present in the esophagus. So first one lies 6 inches from the incisor teeth. Second constriction lies 9 inches from the incisor teeth. Third one 11 inches from the incisor teeth. And fourth one 15 inches from the incisor teeth. Here you can see the pharynx and the esophagus. Constriction lies at the level of arch of aorta, the very beginning, then arch of aorta, then the crossing of left bronchus, then the junction between diaphragm and the esophagus. It is supplied by the inferior thyroid artery, descending thoracic artery, then descending thoracic aorta, and the bronchial artery. Nerve supply by the sympathetic and parasympathetic. Regarding its clinical condition, the applied or the clinical condition related to the esophagus is esophagitis. Itis is inflammation. The gastric contents reflects into the esophagus. Acidic peptic chyme burns and inflames the esophageal mucosa. It causes uncomfortable sensation or heartburn. So heartburn is a sensation because of the acidic component of the stomach. Because when acidity increases inside the stomach, that causes some of the food content to enter inside the lower end of the esophagus, which causes a heartburn. The next structure is the stomach, which is present below the diaphragm. It is a large muscular tube, muscular bag, which is collecting the food material. It is the widest part of the total digestive tube. It is connected above with the esophagus and below with the duodenum. Duodenum is the first part of the small intestine. It acts as a reservoir of the food and helps in the digestion of carbohydrate, proteins, and fat. While seeing the location of the stomach, the stomach is present obliquely on the left side of the body. So it covers the epigastric region, umbilical region, and the hypochondric region, the left hypochondric region. The shape of the stomach is J shape, small letter J shape. When it is partially distended, it becomes piriform shaped. In obese person, it is more horizontal. Then regarding the size, stomach is a very distensible organ. It's about 25 centimeter. The length of the esophagus was also 25 centimeter. While taking the stomach, the length is 25 centimeter here. And regarding the capacity of the stomach, at the time of birth, a fetus will be having a capacity of 30 milliliters. When we become puberty, it becomes 1000 milliliter, and in adults, it may be 2 to 3 liters. While seeing the external features, the stomach consists of 2 orifices or 2 openings, and 2 curvatures or 2 borders, then 2 surfaces. The orifices or the opening is present one at the lower end of the esophagus. This is a beginning, then other at the lower end of the stomach. So first one comes at the junction between esophagus and stomach. Second one comes at the junction between stomach and duodenum. These are the 2 openings. So first opening is called cardiac orifice. Second one is called pyloric orifice. Regarding the 2 curvatures are otherwise called the borders. And these borders are curved borders. That's why it is called curvatures. The curvatures are greater curvature. This is one border, which is a long curved border called greater curvature or the left border. Then this is lesser curvature or right border. This is convex, this is concave. The 2 surfaces of the stomach are the anterior surface and posterior surface. Now, the parts of the stomach, if you take, it consists of 2 parts, a cardiac part and a pyloric part. Upper part is the cardiac part, lower part is the pyloric part. Cardiac part is again divided into a dome-shaped fundus and a body. Then pyloric part divided into pyloric antrum and pyloric canal, which is continuous with the duodenum. So stomach is divided into cardiac part and pyloric part. Cardiac part again divided into a dome-shaped fundus and a body. Pyloric part is divided into pyloric antrum and pyloric canal. The body of the stomach lies between the fundus and the pyloric antrum. Body of the stomach consists of gastric glands. Pyloric part it's having a sharp angulation along the lesser curvature of the stomach. And this pyloric part is divided into pyloric antrum. This area is also consisting of pyloric glands. The pyloric antrum continues with the pyloric canal, which is about 2 to 2.5 centimeter long. At its right end, it terminates at the pylorus. This lower end of the pyloric canal is guarded by a pyloric sphincter. While seeing its relations, since it is a visceral organ, this organ will be having 2 relations. relation with the peritoneum and the relation with other visceral organs. Peritoneal relations means the peritoneal coverings which is related to the particular visceral organ. Stomach is lined by peritoneum. It is a peritoneal organ and can move. It's not a retroperitoneal and it's not fixed to the posterior abdominal wall. It is a movable structure because it's having a covering of peritoneum. So the stomach is lined by peritoneum on both sides. These are the peritoneal folds, one present along the lesser curvature, other along the greater curvature, and this is called greater omentum, which is present along the greater curvature. This is called lesser omentum. So omentum is a common term which can be used for the peritoneal covering of the stomach. Regarding its visceral relation, that means the neighboring visceral organs related to the stomach are liver, diaphragm, and anterior abdominal wall to the anterior surface. Here you can see the diaphragm, this is the liver, both comes and which comes on the anterior aspect of the stomach. Along with that, the anterior abdominal wall is also forming the anterior relation. This picture is showing the different omentum, the lesser omentum along the lesser curvature and the greater omentum along the greater curvature. Apart from having these two omentum, it also consists of some ligaments. They are nothing but the peritoneal ligaments. One is connecting the stomach with the diaphragm, that is called gastrophrenic ligament. You can see the labeling there. Then other is connecting the stomach with the spleen, which is called gastrosplenic ligament. So gastrosplenic ligament and gastrophrenic ligament. Another ligament which is connecting the stomach with the liver, which is called hepatogastric ligament. That is a part of the lesser omentum itself. Now, the relation of the posterior surface are collectively called the stomach bed of the stomach, because stomach is lying over these structures. So, the structures which is present along the posterior part are collectively called the stomach bed. Since the stomach is present on the left side, almost all the visceral organs that comes on the left side forms the relation of the posterior surface of the stomach. So, the stomach bed consists of diaphragm, left kidney, and obviously the left suprarenal gland, because suprarenal gland is present just above the kidney. Then you can see the pancreas, transverse mesocolon. Transverse mesocolon is the peritoneal fold of the transverse colon. Then splenic flexure of the colon. This is splenic flexure of the colon. Then the splenic artery and the spleen. In this picture you can see these different parts. Stomach is given as an outline here, and the structures which is present under the stomach is very clear here. One is the left kidney, left suprarenal gland, spleen, splenic artery, pancreas. This green color is a transverse mesocolon. Then splenic flexure. Splenic flexure means the flexure, the bend of the transverse colon at the level of spleen. This transverse colon is bending at two areas, one at the area of liver, which is called hepatic flexure, other at the area of spleen, which is called splenic flexure. The splenic flexure comes behind the stomach. So these are the structures that forms the stomach bed. I'll say in the interior of the stomach. Stomach has, here in this picture it is opened up, and you can see several rugae or mucosal folds, and they are called gastric rugae. If you are seeing this gastric rugae with the help of a lens, a hand lens, you can see several pits on it, which is called gastric pits. The gastric glands are opening into the gastric pits. The arterial supply of the stomach. Arterial supply means it's a highly vascular, and it is supplied by several arteries like left gastric artery, right gastric artery, left gastroepiploic artery, right gastroepiploic artery, several short gastric arteries. This is celiac trunk which is giving the left gastric artery, splenic artery, short gastric artery rising from the splenic. Then splenic is giving left gastroepiploic. Then this is a hepatic artery on its way. The hepatic artery is giving gastroduodenal artery, which is giving right gastroepiploic. So I have to study only the name of the arteries. Left gastric, right gastric. Left gastroepiploic, right gastroepiploic. Then short gastric and splenic artery. Venous drainage is same like that of the arterial supply. Left gastric vein, right gastric vein, left and right gastroepiploic vein, and short gastric vein. Right and left gastric veins directly opens into the portal vein, so it's a part of the portal circulation. Left gastroepiploic and short gastric veins drains into the splenic vein. Right gastroepiploic vein drains into the superior mesenteric vein. So the first one only drains into the portal, others to the systemic veins. This picture showing the diagram of the venous drainage of the stomach. And now lymphatic drainage. Lymphatic drainage of the stomach is important because clinically it has some importance. Why? Because the stomach is a seat of cancer. Cancer cells are mainly spreading through the venous drainage as well as lymphatic drainage. So having the knowledge of lymphatic vessels and the lymph nodes which is draining the stomach is very important. Upper 1/3 of the area near the greater curvature drains into pancreaticosplenic lymph node. Lower 2/3 to the gastroepiploic lymph node. Right 2/3 near the lesser curvature to the left gastric lymph node. From pyloric canal to the hepatic and pyloric lymph nodes. So several lymph nodes are seen associated with the stomach. Celiac lymph node, left gastric, pancreaticosplenic, right gastroepiploic, pyloric, right gastric, and hepatic. This is a clear picture showing different lymph nodes which is draining the stomach. Regarding nerve supply, it is a visceral organ, so it is obviously supplied by the sympathetic and parasympathetic nerve. The applied condition is peptic ulcer. Can occur in the site of pepsin and hydrochloric acid, namely the stomach, the first part of duodenum, lower end of the esophagus, and Meckel's diverticulum. Meckel's diverticulum is an embryological remnant which is not present in every cases. It's only present in 2% of people. And this peptic ulcer is due to the presence of hydrochloric acid which is produced inside the stomach. So the part of the gastrointestinal tract which can be affected with the ulceration is the lower end of the esophagus, then the stomach, and the first part of the duodenum. Next is gastric carcinoma or the gastric cancer, stomach cancer. It is a common and it occurs along the greater curvature, not along the lesser curvature. On this account, the lymphatic drainage of the stomach assumes importance. Lesser curvature of the stomach is more prone to have ulceration, but the greater curvature of the stomach is more prone to have gastric cancer. So this is about the different areas of the stomach. So while asking the stomach, have to introduce the stomach with its general features like its weight, its measurement, its length, its different parts, borders, surfaces. Then finally enters into the relations. Relations can be visceral relation, peritoneal relations. You have to draw all the diagrams. Then visceral relations, especially the stomach bed, have to be explained with the help of diagram. Then its blood supply, nerve supply, clinical conditions. Thank you.